with oral health care in rural communities.
We have a motion and a second on the bill. Representative, you also have an amendment that is timely filed.
Yes, sir. It is drafting code 4548, and I would have.
We have a motion and second on the amendment 4548 as amendment. You're on the amendment. Please explain the amendment.
The amendment adds language to the bill that further clarifies and attempts to address some of the concerns of the dentists. I'm not claiming that I have mollified all of their concerns, but it is an attempt to do such. What it does several things. It says that a dental hygienist acting under a written protocol authorized shall not diagnose a patient, which is a restatement of what's already in code. It says a federally qualified health center in which a dental hygienist is working under the supervision of a dentist is authorized to, the FQHC, not the dental hygienist, is authorized to bill for the services. And it also states that the rulemaking purposes for teledentistry will be made via the Board of Dentistry. And I can give more background and more information on the total bill if you see fit to adopt the amendment, Mr. Chairman.
We have a question on the amendment. Without objection, question's been called. All those in favor of Amendment 1 say aye.
Aye.
All those opposed, amendment is on the bill.
Thank you, Mr. Chairman. With your indulgence, if I could explain a little bit about the bill.
Yes, sir.
Thank you, Mr. Chairman. A number of us across the state of Tennessee have federally qualified health centers in our districts. I have one that is smack in the middle of my district in Johnson City. Inside that federally qualified health center is a dental wing. It has not one, not two, but 5 dental chairs. It has x-ray equipment. It has everything except personnel. We do not have a dentist that has been willing to either volunteer their time or to be hired on as staff at this FQHC. The net effect of that means that no dental services are provided to underprivileged or low-income people in the Johnson City and Washington County area through this FQHC. What this bill attempts to rectify is the fact that several years ago we passed a written protocol bill. I was the author of that legislation. You all were nice enough to pass it, and the legislature passed it. What it did was it said that a dental hygienist can enter into a written protocol agreement under the supervision of a dentist, doesn't change any of that, and that she may work at public health and at nursing homes. The Board of Dentistry ruled that public health did not include federally qualified health centers, so this is an attempt to clear that up and to clarify that and to allow and to add federally qualified health centers to the list. This bill also adds the term teledentistry to the code. And before the speakers come up and say the world will end with teledentistry, let me be very clear. We just passed a bill last week that dealt with telehealth. Guess what? Telehealth includes teledentistry. What this bill, though, does is it says teledentistry will be sufficient for the initial visit, which is what we require in the code before the dental hygienist can clean the teeth and can examine the patient and provide oral health care. Ladies and gentlemen, when we go out of session in just a moment, we're going to hear a lot of different things. I would ask you to please remain focused on the task at hand. The task at hand is to get people oral health care. I have an FQHC that is not allowed to have any oral health care given to any of our citizens. I am trying to rectify that. I'm trying to fix that with this legislation. And if you have an FQHC anywhere near you that has dental services, this will help your citizens and your constituents as well. I appreciate the adoption of the amendment, and I would appreciate an open mind and an affirmative vote to take this to full committee. Thank you.
Thank you. Any questions for Representative Hill on the bill? Dr. Terry, you're recognized.
I'd like to motion to go out of session to hear some speakers.
Without objection, we're going out of session to hear from... Please state your name at the podium. We're out of session.
Thank you, Mr. Chairman and representatives. I'm Roy Thompson, Dr. Roy Thompson. I'm a general dentist actively practicing in Murfreesboro. Each one of you in this room, when you go for a dental visit, you expect and you deserve to see a dentist. When we're real sick and as we age, we have medical conditions that surpass deserving that, and it really becomes a medical necessity that you have a dentist there. The patients in the FQHC setting are some of the sickest people, some that access the healthcare system the least, and they need a dentist that's there. In this bill, Representative Hill does state that the initial examination has to be done by a dentist. What then can be done, though, through telehealth or teledentistry, a dentist would never have to check that patient again. From that point on, the dental hygienist could clean their teeth and could continue on indefinitely without an examination other than through telehealth. We met with Mr. Hill on Friday, and there were some misunderstandings about the clinic in Johnson City. So on the way back to Murfreesboro, I called the clinic, talked to their clinic manager, and she said, yes, we are the clinic. We've got 5 chairs. We work through East Tennessee. And I asked her, so if I want to come down there and work and get hired, what do I do? She said, well, we're not looking for a dentist right now. I said, well, so what do you mean? She said, well, it's got to go through ETSU, their website, and we are not advertising at this time to hire a dentist. So that is one of the reasons there's not a dentist there. One of the other things that we talked about at that time was this collaborative agreement that Representative Hill mentioned, where hygienists can go into the nursing homes, and we did work with Representative Hill about 3 years ago on that. To this date, we've had 5 hygienists in the state enter into those agreements. That's the only ones. And the hygienist representative at this meeting, I asked her, I said, do you have a collaborative agreement yourself, or do your friends? And she said, no, I don't. And I said, so why? She said, well, the problem is not getting in there. There's no payment source. So the issue of access in nursing homes goes much deeper than being able to have a dentist or hygienist there. In fact, nursing homes are required to have a dentist consultant on their staff. Sometimes you will hear a hygienist may be compared to a physician's assistant or a nurse. Physician's assistants and many nurses at certain levels have the ability to diagnose health conditions. Dental hygienists are not taught to diagnose, and by statute, they are not allowed to diagnose. And when you're putting a hygienist in a clinic with medically frail people or in a nursing home, we can do harm to those individuals. So I suggest that this is much more serious than just getting your teeth cleaned. And I hope that I suggested to the FQHC in Johnson City, I asked if they would be willing to put a dentist on their board of directors, and so that dentist that's well connected and understands the board of dentistry rules, could they work with that dentist to find a solution? And she said, we would love to do this. And that was my suggestion to Representative Hill, to let them solve this with a dentist on their board, working through the Board of Dentistry, and working with a local dentist to both find volunteers. There are hundreds of dentists coming out of dental school each year, young dentists looking for jobs. If they advertise, they will find a dentist. So I hope y'all will see this as much deeper issue. The Cameron Sexton bill that y'all passed earlier in session that deals with telehealth includes teledentistry and offers our boards a chance to define some of those.
I think we have a question
Yes.
for you. Chairman Sexton, you recognize.
Thank you. Did I hear you right that you said that this legislation will allow the dental hygienist to diagnose a patient?
The first visit has to be done by a dentist. That's what the amendment requires, is the dentist sees the patient first. From that point on, if the patient is there, it can be done by telehealth, but the dentist does not have to be there.
Right. Well, I'm reading the amendment, and it says the one that was just added on, that dental hygienist acting under a written protocol authorized by the subsection shall not diagnose a patient.
Right, initially. But from that point on, by telehealth, the dentist is not going to be seeing that patient personally. They're going to be doing that by remote. So that initial visit, yes, that's the Representative Hill's amendment, that initial visit, a dentist would have to see them.
Can they diagnose the patient at any time?
No. Dental hygienists are not allowed by statute or by training to diagnose.
Right. So under this legislation, under that section I read, do they have any capability of diagnosing the patient based on this amendment language?
No,
at
not
any point?
based on the amendment, no.
Okay, thank you.
I had a quick question there. So what you're saying, and I'm trying to get legal here to clarify this one way or the other, but based upon what you said earlier, you said that the dentist had to be there for the initial diagnosis, and then you said the hygienist could see that patient in perpetuity after that without going back to the physician. Is that correct?
My understanding is that correct.
But by your own bill last week, the argument was made that you could do teledentistry out of Representative's bill last week, which would not require the dentist to see the patient. What is the difference between the dentist seeing the patient in teledentistry and the patient seeing the patient seeing the dentist in teledentistry or telehealth?
I wasn't here, so I didn't hear that testimony.
But to me, it seems like it's the same thing.
Diagnosis is the key. Diagnosis is the key. This bill does not allow for diagnosis still, even the amendment.
Okay, let me restate the question. If I come to see you for that first initial visit, and it's in person, and then I go to a hygienist to get my teeth cleaned after that, and I can keep coming back as many times as I want, and if I need to go see the dentist again, I cannot do it through telemedicine, or I can do through telemedicine?
I think this bill allows you to do it through telemedicine.
Thank you. Yes, I think one of your colleagues would like to be recognized to help clarify the question.
Jack Fossbinder, Tennessee Dental Association. Representative Sexton's bill that passed has to do with teledentistry between licensed professionals who have the ability to diagnose. So the bill that you passed last week allows professionals to use teledentistry, but only professionals who have the ability to diagnose what they're looking at when they're looking at it from the remote location back to the person who's on the video or whatever they are. So it's between two licensed professionals who have the ability to diagnose.
Thank you.
Extends that.
Thank you. Better clarifies it for me. We are running out of time. We have several other bills to get to. Representative Hill, you're recognized.
Thank you very much. Let's be very clear. The dental hygienist is still under general supervision. We're not changing any of that law. We're not changing any of the law. In fact, we're restating the law that they cannot diagnose. And the law already states that they have to, a patient has to be seen by a dentist every 11 months. We're not changing that either. So the statement that they'll be able to not ever see a dentist again is not factually true. Ladies and gentlemen, this bill is very simple. It allows your rural constituents to be seen and to get oral health care at FQHCs. Please allow them to be able to do that.
Question has been called on the bill. I'm sorry. Without objection, we're back in session. Question has been called. Without objection, there's no objection. We have objection. Representative Favor, you are recognized.
Thank you, Mr. Chairman. I had a comment to make. I've gotten many calls from dentists in Chattanooga, and I was administrator of 2 community health centers in Chattanooga, and we did utilize a dental hygienist, but we had dentists, and it wasn't difficult to get them. One of them just retired after about 30 years. But I cannot feel comfortable voting for this bill because I feel that it's very important that you have appropriate level of personnel, health personnel. And since these dental hygienists don't have the ability to diagnose by statute, I will have to respectfully oppose this bill. Thank you.
You called for a question, but we had an objection to the question. So we're back without. Question's been called on the bill. All those in, without objection, all those in favor. 976. All those in favor of House Bill 976 say aye. Aye. All those opposed. Chair is calling for a roll call vote on this bill. Will the clerk call the roll?
Representatives Clemens, Doss, Faison, Favors, Hill of Washington, Kumar, Matheny, Sexton of Cumberland, Terry, Chairman Williams.
The bill fails for lack of majority, 5-5. The bill dies.